Hello, my name is Sheryl Green. I'm a professor of radiation oncology at the Mount Sinai Medical Center, and I am also the medical director of the practice in the Department of Radiation Oncology at the Uptown Mount Sinai location. So radiation oncology is the area of medicine where we use radiation therapy to treat patients who have cancer. Essentially, radiation treatment is the use of high energy X-rays, which are targeted to the actual cancer area to essentially kill those cancer cells. Radiation treatment can be given alone, or sometimes it's used after surgery. Over the past decade, there's been enormous advances in the area of radiation treatment, and we're now able to much more precisely deliver our radiation treatments to target the cancer whilst minimizing any radiation treatment exposure to the normal tissues that are nearby. So this has allowed us to really cure a larger number of cancers while minimizing the long-term negative effects to the normal tissues nearby. So the length of treatment varies depending on the patient's specific needs. So it will vary depending on the body site that needs to be treated. So for instance, are we treating the breast only after lumpectomy? Sometimes radiation would be given after a mastectomy, and then we're treating the area where the breast used to be together with the lymph node areas. So most of our treatment regimens now can be completed in 3 to 4 weeks. However, some women still require a longer course of treatment that may be 5 to 6 weeks. Over the last few years, we've actually made tremendous advances in sort of introducing shorter course treatment, and many of our patients are now actually eligible for treatment that can be completed in only 1 week. So Monday through Friday, 5 treatments. So chemotherapy is what we refer to as a systemic therapy, meaning that patients will take chemotherapy either via the mouth or intravenously, and then that has the ability to travel all around the body to target a cancer cell anywhere that it may be. On the other hand, radiation is what's referred to as a local treatment and only has its effects where we specifically direct the radiation beam, which would either be to the breast itself or to the area of the chest where the breast used to be, or the lymph nodes that the breast may drain to. So the most frequent side effects during the course of radiation is generally some fatigue, which is a variable entity. Some women have very mild fatigue. Others may notice it a little bit more significantly. Either way, it tends to be a temporary side effect, and for most women will significantly improve or resolve within a month of the treatment being over. Also, when we radiate the breast or that area after a mastectomy, there will be some changes in the skin of the breast area, and that typically manifests as a slow, gradual pinkening, reddening, darkening of the skin. There might be some sensitivity of the breast. There might be some temporary itching of the skin, and we can control all of these and keep them comfortable with different forms of creams and lotions. Again, the skin reaction is too largely temporary, and for most women, most of the discoloration will fade away after the treatment. There are long-term side effects that need to be considered, and for us, the key issue is going to be treating the breast, but protecting the normal tissues that are nearby. So the key tissues that we need to protect would be the lung behind the breast, as well as the heart and the liver. And with the techniques that we're able to use nowadays for treatment, we can really keep the risks of injuries to these normal tissues very low. Some women where we have to radiate the lymph node areas, especially if they've had a lymph node dissection prior to radiation, may be at risk for developing lymphedema or swelling of the arm. Radiation too has a very small risk of causing a second cancer, but in most patients, this risk is really extremely small, and the benefits of radiation far outweigh any of these potential negative effects. So Mount Sinai is offers state-of-the-art breast cancer treatment, and we really offer all available options for breast cancer therapy. So we offer typical external beam radiation treatment delivered after a lumpectomy or a mastectomy, and we use the most advanced radiation treatment techniques to deliver therapy. We also offer partial breast radiation, where instead of treating the whole breast, we're able to target the radiation to the most at-risk region of the breast. We also offer intraoperative radiation treatment, where patients may have their radiation treatment delivered at the same time that the surgical procedure for the lumpectomy is performed. And in many women, their sole treatment will be delivered intraoperatively together with the surgery, with no need for any additional radiation thereafter. We also have the ability to take care of patients at our proton facility in Harlem, and we would refer patients for proton therapy, which is the most advanced form of radiation, typically for women that may have more challenging anatomy, or in women who have a recurrence after having had prior treatment.